So, good morning, everybody. Thank you for joining us. I have today with me uh, Kalli Rose Kelley, uh, RN, registered nurse of the Mama Coach, and she is the newest member of the Suffolk County Acupuncture team. So, I'd like to introduce her to everybody and just get to know her a little bit and how she's going to be helping us and what she's going to be offering everybody here at Suffolk County Acupuncture. So, Kalli, thank you for joining us. It's been a pleasure, and please tell us a bit about yourself.
Good morning, everybody. I'm so happy to be here. Um, so, like Dr. Vitale had said, my name's Kalli Rose Kelley. I'm a registered nurse. I recently started my own fertility coaching practice through the Mama Coach, and nobody really knows what fertility coaching is. It's kind of a new thing. It's where I'm supporting women who are trying to conceive, not necessarily like just in IVF, but trying naturally, looking at them as a whole person, seeing what's going on in their lifestyle, and then working with their programs with their reproductive endocrinology team or just their OBs if they're still just with their OB practice. We're really looking at their lifestyle, what testing's been done, what they could like additionally ask for. I'm kind of just their like personal advocate, telling them what is out there, having them question their providers. A lot of stuff now in medicine, you have to push for protocols and thinking outside of the box. So I'm kind of their little person on their shoulder, talking in their ear and helping them with what they should ask for. I also focus my like my coaching packages if someone's leading into like an egg retrieval or embryo transfer. I have packages tailored just for that because those can be really emotionally challenging, physically challenging with side effects of everything. And then let's talk about the medications and the like med administration and the side effects. So I can either help them administer or, walk them through how to do it in the beginning. So I'm kind of like their own personal concierge nurse from home.
That's fantastic. That's great. What a wonderful service that you're providing. And that's one of
Yeah.
the reasons we wanted to bring you onto the team is because one of the things I find, just, having been treating for so long is the mental, emotional aspect of what's happening in this, this women going through this treatment,
Yeah.
even whether they're trying naturally or they're going through ART, is the mental, emotional tax that it plays on the body. And
Absolutely.
yeah, it's really strong and it's a huge aspect of what's preventing things from going forward. As an acupuncturist, as you know, acupuncture does a very good job at reducing physical stress on the body. So it brings your nervous system down,
Great.
it relaxes, takes you from sympathetic to parasympathetic, which can help, the physical body. But there's
Yeah.
that emotional aspect that I just don't have the time for myself because when I'm with a patient, I have 15 to 20 minutes to spend with them while I'm inserting needles, and it's not enough, I think, to really support the patient in the long term.
No, like, and I remember myself when I was going through my own fertility treatments and I was seeking acupuncture through your practice. And it was great. Like, we had great conversation. You really like asked how I was doing. And that hour that I was there, I got to relax. You fall asleep or you're meditating, but then like you leave and then eventually the emotions start flooding back. You go to your next monitoring appointment and it's just overwhelming, like you're saying, you have the 15 and 20 minutes in the office with the patient and like you're asking how they're doing as a whole person, but even when they're at their reproductive endocrinologist, some practices you don't see the doctor every time. And they can feel like a factory almost. So, for such a personal journey that each woman or family is going through, to not feel that they're getting personalized attention, it takes a toll, especially if it's not working their first cycle or their next one.
Yeah, that's the common thing I always hear is that even as good as an RE can be, these IVF centers can
Yeah.
be, the demand is so overwhelming that they're booked out months in advance, and they really have 3 minutes to spend with their patients. And the patients, like you said, just feel like a number, like it's a factory.
No, and I know, I mean, I know doctors don't necessarily feel like that about their patients, and they probably wish that they could spend more time with each individualized person, but there's only 24 hours in a day, and the need for their service is so high right now that it just, the system doesn't really allow for that, and that's where I kind of come in.
That's great. And that's the need. That's really we're fulfilling that need because like you said, I think these doctors, I've worked for a long time. I was the on-call acupuncturist at Long Island IVF under Dr. Kreiner for many years. And
Right.
I would show up at their door, I would do the acupuncture pre and post there. And I was always amazed at how packed the parking lot was at 6 a.m.
Oh my gosh, the 6 a.m. monitoring appointments are going in for their retrievals. It's
Saying how, yeah, it's crazy how
And think about it,
busy
that's
we
one
are.
practice. Like there's so many practices now, and I feel like it's kind of the same thing at every practice.
Yeah, yeah. Yeah, they're all overwhelmed. They
Yeah,
are all overwhelmed because obviously it's an epidemic. As we know, it's not getting better, it's getting worse in the
right.
world. And that's a whole nother conversation for
Yeah,
another time of why we're experiencing such an epidemic of infertility, which, we can only address one person at a time, unfortunately.
right.
But that just shows that the system is overwhelmed from their perspective. So from what we can do as a acupuncture wellness center is, like I said, one person at a time. We just help rebuild health. We help rebuild, physical health through nutrition, through lifestyle changes, through the right
Right.
supplementation, through adjusting the body with acupuncture, with lasers, with massage. So many tools at our disposal, and yet the mental aspect is often um, not ignored, but not properly addressed. So that's something I want to ask you about. So, what approach do you take with our patients in getting them through the difficulties? Like, what do you do for them?
So, I'm not a licensed therapist. My background is as a registered nurse. I
Mm.
worked inpatient for the majority of my career, 10 years now as a nurse. But you learn a thing or two about how to mentally support people going through challenging times, whether it's like life-altering diagnoses or, end of life care. So I've taken that knowledge that I've learned over the last 10 years as a nurse, working bedside, and I've applied it into my practice, and I'm constantly reading like support books and everything like that. So although I'm not a licensed therapist, I approach each person, just listening at first. I want to hear what they're feeling. Are they getting the support that they need from their spouse or their family? Are they keeping it all bottled in because maybe they don't want to share what's going on? People are private, and this is a very private subject. Some carry a lot of guilt and embarrassment, and I just like to let them know that I'm here, that their feelings about everything are valid, and I kind of give them the tools that they have all like they have it. They're strong women. They wouldn't be going through this if they weren't strong, and I try to just help them look within themselves and realize the strength that they have and that they're empowered and they can really, you know, advocate for themselves. They can feel their feelings in that moment, but then they take control over their mindset, and whether it's finding outside methods of going for a walk or, I'm sure a lot of these women had hobbies. Maybe they were really into exercise, but then they're being told they can't do that high intensity exercise. So now what are they supposed to do for their outlet? And we look at what they were doing and find that balance. I myself, I was an avid CrossFitter before I started trying to conceive, and I full blown stopped CrossFitting initially because that's what they told me to do. They said it wasn't going to be productive for me getting pregnant, and that wasn't good for my mental health. And then I did take a break from everything. I did go back into a CrossFit gym, but I found trainers that were like, we can tailor this so the intensity is not as high, but you could still do something that you enjoy. And that was incredible. And then I've evolved from there. I started coaching, like in the CrossFit gym and working with women who are getting pregnant. And it really just kind of opened my whole world up as to what I could be doing to help others.
That's fantastic. That's great. And again, drawing on your own personal experience.
Yeah.
I know a lot of time with people say coaching. I've worked with other coaches in other industries over the years, and I know the difference between a coach and a cheerleader. So, what some people call coaching, it's really cheerleading, where if someone has a problem, they're like, oh no, you can do it, kind of what a cheerleader does.
Yeah.
But what a good coach does, and using the sports analogy, is a good coach can look at what somebody's doing and see what they're doing right, what they're doing wrong, and offer constructive advice, constructive criticism. Oh
Right.
no, a good coach will look at an athlete and say, no, your grip is wrong, or your throw is wrong, or
Right.
your
You want to
posture is different. And that's what a good coach does versus just rah, rah, you can do it, you can do
Right.
it.
Cheerleader's going to get somebody hurt. You know what I mean? Like, that's not a good coach. I was a competitive gymnast for most of my adolescent life. So I had to have good coaches because that's a very dangerous sport.
Hmm.
So I guess that mindset's been ingrained in me from a very young age. But even with CrossFitting, like if you're lifting and going to do like a powerlifting movement and you don't have the right body position, and if I'm not recognizing that as your coach, I'm not gonna like you're gonna get hurt on my watch, and that's not something I ever want. And circling it back to my fertility coaching, like I'm not going to let you take a supplement because you read online somewhere that that's going to increase your chances, when really it's going to disrupt your hormone balance and really like mess it up completely. So I come with knowledge. As a registered nurse, everything's about evidence-based practice. So if they come to me and they say, I found this, what do you think about this? I'm going to return back with studies and why maybe some people are saying it's working, but let's look at you as an individual and why maybe it's not going to be the best thing for you. And that could be why your reproductive endocrinologist isn't suggesting it. And the same goes with testing, you know, endometriosis and PCOS, those are the pop words right now. And yes, there are women that are suffering with both of those conditions, but not everybody has that. And to put yourself through, invasive procedures because you think maybe you have endo and that's why you're, not getting pregnant. Why don't we look at your lifestyle, decrease your inflammation, and maybe you don't have endometriosis, maybe it's just an inflammatory process that's going on, and we need to kind of look at what we're putting into our body.
Absolutely. Yeah. Yeah. Dr. Google is very dangerous.
It
Yeah.
is. And we all fall trapped to that. I was a new mom with a background in pediatric nursing and I was still on Google. That's kind of how I found myself to the mama coach. Because I was like, I need to figure out what's fact versus fiction, and really hone in on what I can rely on in the information.
Good. That's, yep. Yep. That's very important. Absolutely. So tell us a little bit about what a call would look like when you work with a patient. What does a call look like when they work with you?
So initially, like through the practice, it starts with a 15-minute discovery call, just kind of finding out like their history and everything. When I'm going to be working with the patients here at Suffolk County Acupuncture, I already am privy to, what they've disclosed to you and their intake. And so I'm already reading through their health history and finding out kind of where they're at. Sometimes they need to bring me up to speed because things change weekly in the IVF world or daily sometimes, depending on how they're responding to medications. So we'll quickly talk about, what exactly they're at like that day, what supplements that they're taking, what vitamins, how often they are they seeking their acupuncture treatment, have they tried the laser therapy, the Giga laser, and how do they feel like it's working? And then they can give me honest feedback. Sometimes maybe they're intimidated to tell you, I didn't like this treatment or what. And I'm there to, really just listen to them, how they're feeling about it. And then after they let me know, I'll make suggestions based on the information that they shared with me. Our calls are typically 15 to 30 minutes. And then we check in once a month through the practice. But if they felt like they wanted maybe a little bit more support, then we can kind of, discuss what the options are outside of that. And then my typical coaching packages we talk for about an hour to 2 hours, depending on, what they've been through. Some women are coming to me after trying for 5 years. So they have a lot of history to disclose, and there's a lot to go through. And then I come up with a fertility coaching plan, and we check in daily or weekly, depending on the package and how they're feeling about the plan, what they're doing, what they're not doing, why they feel like they can't do it, and then we make adjustments from there. So I'm basically on call 24/7, especially when they're leading up to an egg retrieval or transfer, because their body's constantly changing with what medications they're on, how much they're stimming, and they really want that support that a doctor's office can offer, or even like with you, they're seeing you maybe once, twice a week. So,
Yeah, they're just further supporting them through the process. Yes.
exactly.
Yeah. Yeah. I know personally, when I work with a fertility patient, in a perfect world, I'd love to catch somebody at the very beginning of their journey, of the
Right.
fertility journey. And if I could put a billboard in the middle of Times Square saying, start sooner and address the physical stuff that we discuss before or during your initial
Right.
trying, because oftentimes we catch people at the very most desperate times of the tail end of, they've
Yeah, they're like,
already done.
what else can I add to my like attempt to optimize my chances of success? I've had failed cycle after failed cycle, and they're just trying everything. And
Yeah,
that's why they're coming to you and I, because they're at their wits' end. They trusted their doctor, it's still not working. What else can they do? And not every practice offers everything that's out there. And so you have to say, like, well, am I a candidate for this? And you and I, like, we don't have any financial benefit of whether they go and pay for like ovarian PRP or something like that. Like, but maybe it's a conversation. We can weigh the pros and cons with them if it's worth that investment for them. It might not be perfect for everyone,
right.
you know. So
Yeah, yeah. It's really crazy how the world is with that, and but the services that you're providing them is invaluable. Let me ask a question about the 2 week wait. So you obviously you know all about that. The 2 week wait is a particularly stressful time from the day of transfer and
absolutely.
until or the RUI up until they take the test. That those 10 days to 2 weeks can be
Right.
somewhat stressful. What is your advice or what is your suggestions for people when they're in that? Like, how do you support a patient who's going through
We're
the 2 week
talking, because it's a lot of symptom chasing during that 2 week wait. Was that little twinge in my uterus, like the embryo implanting? Am I bloated because, I'm pregnant right now? Is that breast tenderness from the the trigger shot, or is it from like that it worked? So we're texting, we're emailing. Some women I do offer like calls like three times, up to 3 times a week, if they want to talk through it a little bit. And I just kind of, ease their thoughts, not necessarily explain what they're feeling because it could be, but you and I, we're not a magic 8 ball. We don't know if it worked or not.
Right.
We know what we did to help them, optimize everything that they could have. I remind them to continue the bone broth, to continue the pineapple core, to continue eating anti-inflammatory foods, whole foods. Don't just jump right back into, like poor lifestyle choices. Um, Movement. We want to walk. We want to promote blood flow to the uterus, but we don't want to overdo it. Managing our temperature during that time is important. So we kind of go over like just reminding them what they should be doing, what they shouldn't be doing. We discuss whether they should test at home and or not. Every person's different. Everybody's mental place is different. Some people can go into testing at home and, not feel discouraged and just be realistic about it. Some become obsessive over it. And hopefully, I've gotten to know somebody before that point and I can kind of, which way we should kind of go with that.
Mm.
And if they choose to test at home, I'm also, in a way, I kind of shift gears and I'm still their cheerleader and I'm still telling them to not count themselves out because nothing's as accurate as a blood test. But, let's be realistic. Every person is impatient. We're human beings and we
Yeah.
want to know. It's something we've been trying for a very long time. So the 2 week wait is hope and fear, and I'm just there to kind of help any way I can during that time.
Yeah. Yeah, that's great. And that's when they need the support the most because,
Absolutely.
from the day of the transfer, they're told, okay, go home and relax. I'll see you in 2 weeks. And they're just lost in limbo.
Some women are like, I'm not going back to work. I'm not doing anything. I'm just going to sit and wait for 2 weeks. And that is never, that honestly is not my recommendation. Take
No,
the day
no,
of transfer off, of course, but you want to go back into your routine. You want to have like a sense of normalcy because so many people will put their life on hold because they're going through IVF and they don't want to do anything to mess it up, or what if I'm pregnant at this time? And I was a victim of that mindset as well. And then I was like, that's not doing anything for me mentally. Like I'm missing out on things I would have enjoyed because I might be pregnant. No, get the insurance on the trip. If you have to cancel it, you cancel it, but still book it, and give yourself something to look forward to. Because if you're not pregnant, you're gonna want that trip.
right. Yeah. Yeah, that 2 week limbo is like they
Yeah.
dwell. It's so easy to go into the negative and dwell on the negative, like you said, like, oh,
Absolutely.
it did work, didn't work, something like
Yeah.
that. So,
And
yeah.
I work with mental health professionals, also because they have clients that their scope of practice limits them as well. They're there as their mental health professional, but they don't fully understand all the medical jargon that's going on and
Mm.
what maybe the medications are doing to them to affect their mental health. So I collaborate with mental health professionals as well. If they have clients that are going into their 2 week wait, and we communicate as a team to make sure that we're addressing those, negative thoughts. And um, I think it's a really great holistic approach to everything.
It's important. I think that's very important to just put it into perspective and realize how your thoughts can create your reality, or at least affect your physical being.
Exactly.
So many
Stress
studies.
is no good for anybody, whether they're in fertility or not and going through infertility. Stress has like your cortisol levels, we all know, like it affects so much. So if we can reduce that in any way, that's still a win in my book.
Yeah, yeah, I think so too. Yeah, and that's a great support, that you're going to be providing our patients here,
Yeah.
for that especially, but the whole journey, not just the 2 week wait, but leading
No,
up to.
no, yeah, and especially like, so my background bedside was pediatric nursing, neonatal nursing. So, they get pregnant, and I'm also birth assisting, like I shared with you recently, with the midwife group. So I can help them, stay healthy throughout pregnancy and even into their like new motherhood journey. So we're gonna help support them through it all, and it's an excellent service that we're gonna be working together on.
Excellent. Yeah, we're very excited. We're looking forward to that. Absolutely. So let me ask you, just shift gears a little bit. So we are working with a patient together, and a patient, there, oftentimes, I'm always suggesting lifestyle changes, as you will too, since you know nutrition, you know lifestyle, you know all of that.
Right.
What's your approach to helping patients stick to the lifestyle changes that are recommended? What's your approach to that?
Accountability. Accountability. So, even myself, like we fall victim of like, okay, I'm going to start on Monday. I'm going to, make sure I'm cutting out the added sugars. I'm not going to get the ice cream. And if nobody's there to hold me accountable, then I'm going to say, yeah, it's just one day. Right. And the same with these women. They're like, well, it's really stressful. This monitoring appointment didn't go the way I want. I only have 2 follicles. Like, what's the point? And I'm going to be there. Well, there is a point. There is absolutely a point, as because those 2 follicles could turn into 2 blasts, and they could turn into 2 PGT, like normal embryos, and you're going to want, to know that you did everything to make sure that happens. So we talk about, how their nutrition plays a role, and obviously like changing your diet for, 5 days isn't going to make a difference. It's a lifelong commitment, and overall they're going to feel better for it. I know I did. I felt the best I ever did when I cut out, any inflammatory foods. And alcohol and minimize my caffeine, and everything's a balance. I'm not here to tell people all or nothing because that's not a realistic approach. But we're going to weigh the pros and cons. We're going to say, well, do we need to go out and, have a whole bottle of wine, or can we have one glass of wine? So that's where I am. I'm their accountability. I say they can send me their food log if that's something that they do, and I could say we can tailor it. So they're not completely like having to go throw out everything in their pantry and their fridge, but we'll find what's there and say how this could work for them.
So I think if you recall the sitcom The Office, there was an
Hmm.
episode where they called it the accountability buddy. So
Yep,
you're their accountability buddy.
I
So
am.
that's so important because, like you said, at a time of desperation, it's so easy to just reach for that extra slice of
Right,
cake or the glass of wine or cannabis now, which is a big issue. So having somebody to hold you accountable and someone to ask, oh, what do you think about this? If they're
right.
not can't get a hold of me in their weekly session, having you on hand is such a valuable thing because again, accountability is going to be so important and it takes a team. It's going to take a team
Right,
here.
it
And
does. And sometimes, like I said, like I spoke about earlier, sometimes their partners don't fully understand. Or, on the other caveat, what is their partner's lifestyle looking like? Some women are making all these changes and their partner's still going out and doing everything that they were doing prior. And maybe they should look at their lifestyle too. And we talk about the couple as a whole if they're trying with a partner. Some people are single moms by choice, so that's not always the case, but like I said, we tailor it to everybody individually. So I will be asking about their partner and what their lifestyle looks like a little bit too.
that's so important. That's a question I was meaning to ask. So, I think the male factor is over or grossly under emphasized as far as, leading causes, of unexplained infertility, more than
Right.
50% is male factor. And oftentimes when I consult with a new patient, I often encourage them to bring the husband into the consult because it takes two. It takes two to tango, and oftentimes the men are reluctant to either participate or even make any changes. I know you work with the couple, but do you ever work with the men specifically, or do you just
I haven't had any male seek out my coaching services individually, or like any wife say, you work with Callie.
yeah,
I already know what I need to do. So it's usually as a couple, I will tailor the coaching plan that it will have a male lifestyle section. So I do address the male, but I'm not ch necessarily checking in with him. If that's something I can absolutely do if the family wants that. But I haven't done check-ins with the male partner per se.
yeah, that's the hardest part.
Yeah.
Men have such delicate egos.
Yeah. Yeah.
Being a man, I can attest to that. But men
And I'm going to
often
agree with you, and that is where I'll stop the conversation.
not going to male bash because I am a guy and I do advocate for my male patients. And I think as a man here, I do offer some expertise in that area of, for the men of, the male half of the couple experiencing this. Men need to step up. Men need to, acknowledge that what's happening here, they have to participate in a way that's going to add to, the benefit that's going to help this and not just turning a blind eye saying, oh, my levels are normal. I don't have to make any changes. No, it's there's more to it than that, than just your sperm count was within normal ranges, so I don't have to make a change. No, absolutely. You do
Especially
have
if
to.
you're still trying to conceive naturally, like we take into the IVF aspect of things, they can select the best looking sperm, they can utilize, ICSI. Um, so they have other tools if they're strictly doing IVF, but if they're still trying to conceive naturally with timed intercourse or IUI, we really need to be making sure that these male partners are, doing what they need to be doing on
Doing
their.
the right thing, exactly. Yes, stopping the smoking, stopping the cannabis is such a detrimental thing, even
Right.
though it's
The
been legalized.
vaping, a lot of men like to work out. What's in their pre-workout?
Yeah,
What's in their supplements that they're taking? Like that could be affecting everything.
yeah. Yeah, and it's frustrating. I would say that working with the male partners is a challenge again because men are very headstrong and reluctant to make changes or even admit that the male factor could be a part of the problem, and
Right.
making those changes are difficult. But I often emphasize that they have to be on board and at least to support the women in their lives, to be
Yeah.
the rock and support them in a way that they can, and that's just by being a part of the process and
Yeah,
not
I know I have seen like really great couples like throughout like my time like as a fertility coach that they do have great partners that are very present and supportive and they have the ability to go with the women to every appointment. Not everybody has it. I didn't have that personally. My first embryo transfer, my best friend was in the room because my husband couldn't take any more time off
Mm,
because we had taken a lot of time off for multiple, egg retrievals and he has to be present for that part of things, but an embryo transfer. And so, like, I kind of help women and families, navigate that if their spouse can't take the time off, or, I make sure that they have somebody in their life that can support them. And if not, it's me.
fantastic. That's great. Yeah. Excellent, excellent. I know we're coming up at the end of the hour here. Do you have any other things you would like to share with the audience? Anything else in particular you would like to talk about, or just share with that, about how you help?
I feel like we touched upon a lot of what I like offer and what I'm doing. Like I said, I'm basically at their disposal depending on where they're at in their journey. If they're in that 2 week wait, like I'm there 24/7. I have my own family. I'm lucky enough. I have my own daughter, thankful to IVF. And I still feel such a need to help others. So, I make it work where I'm present at home and I'm there for them. So I'm just really happy to be able to do that for these women. I also have the ability to like take a look at their labs. Maybe their doctors aren't explaining everything to them, like what, each level means. So I have women sending me like their screenshots of their patient portal as soon as they get them. And then we're talking about them. And then so I want them to know that like I come with the medical knowledge, I am able to kind of interpret their labs a little bit, like obviously within my scope of practice as a nurse. I can help them raise questions. I'm never going to contradict what their doctor is saying, but I'm going to tell them that they should ask certain questions and let them get the detailed explanation, as to why they're saying go on this medications versus another one. I also offer injection support. I don't know if we spoke about that specifically. But if they're ever like needle phobic or they don't have their partner home to administer any of their medications, that is something that I can also offer them. So I wanted to just kind of make sure they know that. Whether it's via Zoom because they're worried about the technique. I went to nursing school to learn how to inject my, patients with for subcutaneous and IM injections. They're getting a quick video that sent to their patient portal, and the nurse is going over it really quickly in the office. And then they're like, go ahead, go mix these meds, draw up this medication, don't get any air bubbles, inject it at the perfect angle. And they're like, what do you mean? So.
That progesterone shot is a doozy.
Yeah, and exactly, like I'm still sore and I haven't used any progesterone and oil for months and I'm still working through the muscle knots that you're left
Mhm.
with.
Mhm.
So, and I know what to do and everything like that. So, I just want them to know that I can also be an asset and a resource for them with that aspect of things.
Excellent. That's great. Thank
Yeah,
you.
No problem.
Excellent. Well, this was wonderful. I hope this is going to be the first of many conversations that we'll have.
Yeah,
There's a lot of exciting things coming down the pike with our collaboration here at Suffolk County Acupuncture and your work, and I'm excited to have you as a part of our team.
I'm really excited to be here, and I'm so excited to help more women.
Excellent. That's fantastic. Thank you so much, Callie, for your time, for your effort, for your knowledge, and just being just a wonderful person who's just looking to help. So thank you so much for being a part of us.
Not a problem. I will talk to you soon.
Excellent. Thanks, Callie. Have a great day. And thank you, everybody, for watching. And be on the lookout for more information from us.
All right.
Have a
Have a
great
good
day.
day.